A very warm welcome to yet another edition of the Spotlight. Now, over the past few weeks and months, we are seeing many reports coming in the surge of dengue fever in Sri Lanka. As a national television broadcaster here in Sri Lanka, we are doing everything in our capacity and capability to shed light on important concerns related to the general public, and that is exactly what we are here to do today. Now, today I have the opportunity to speak to Dr. Anoja Dheerasinghe, consultant community physician from the National Dengue Control Unit from the Ministry of Health, to have an extensive discussion on the rise and the surge of dengue fever in Sri Lanka. Thank you, Doctor, for joining us today. Doctor, my first question for you is very simple. An overview and what is dengue fever?
Actually, dengue fever is a viral disease. It is transmitted by a mosquito, Aedes mosquito. There are two types of mosquitoes in Sri Lanka, Aedes aegypti and Aedes albopictus. Those are the two vectors which carry the virus to the human being. And once you infected with dengue virus, you get dengue fever. There are spectrum of disease, like asymptomatic patients. Those patients, they don't show any symptoms, so we can't diagnose that people had dengue. And also another set of people, they are having just like febrile illness, so usually they won't come to the hospital. And another set of people, they have dengue fever. Usually those people, they get with severe, not severe, but some symptoms. They get fever, headache, body aches and all those things. So they usually visit a doctor or the nearest hospital. And another set of people, they get complicated dengue hemorrhagic fever. So they have severe symptoms, so they will come to the hospital.
So, doctor, either the patient shows symptoms or doesn't show symptoms. So it can be quite tricky to diagnose, isn't it?
Yes. Usually people who don't have symptoms, they won't come to the doctor. Even other diseases, they do have this category. But only the symptomatic patients come to the doctor or to the hospital.
So, doctor, now if a patient is asymptomatic, but they're dengue positive,
yes.
Correct me if I'm wrong.
Yeah.
How do they know that they're probably having the dengue fever?
They won't. We won't be able to diagnose them unless we do a serotyping in the community. But that is very costly. But we don't go behind those asymptomatic people, but we try to diagnose the symptomatic people, because we need to apply the control methods when we diagnose the people. So that is important, to diagnose the symptomatic people.
Doctor, just give us a briefing and differentiate between dengue fever and we also say dengue virus. What is the comparison there?
Virus is the infective agent that causes the dengue fever. That when that virus enter into our body, our body fight against that virus, but when the fight is failed, we get the disease.
Right.
So that is dengue fever or the dengue illness.
Then in Sri Lanka, doctor, do you all see a particular area or particular areas where dengue is most prevalent?
Yes. Actually, Sri Lanka is an endemic country. Throughout the year, we get the dengue patients. But there are high endemic districts, like especially Western Province. Usually we get 45% to 50% of cases from Western Province, and then from the northern part in the Jaffna district, and the eastern part usually we get high number of cases from Batticaloa district and from Trincomalee and the Kalmone area. And the central province, usually we get high number of cases from the Kandy district. In the southern part, mainly the Galle district, and some patients from the Mathura district as well. And the northwestern part from both Puttalam district and the Kurunegala district, we get fairly high number of cases. From Sabaragamu, both Ratnapura and Kegol, we get the high number of patients.
Doctor, now over the past few days, as I mentioned even in my introduction, that we see a rise in dengue patients, and we constantly keep getting news reports that there is this amount of dengue patients. Sri Lanka is a tropical country, and we have the cold climate and also the hot climate. In which does the dengue mosquito thrive more, in the cold, in the rainy weather, or during the hot season?
Actually, in Sri Lanka, the temperature fluctuation is very minimal compared to other countries. But the high temperature is very good for the mosquito. We get high number of patients during 2 monsoonal period, because we can get high number of receptacles with water, so it's easy for mosquito to lay eggs in those receptacles. So then the mosquito density will go up, and the transmission of the virus to the human being will go up. That's why we get high number of cases during those 2 monsoonal period.
But even during the hot climate also we see a high
throughout
surge,
the
isn't it?
year we get the cases, because there are indoor breeding places. Even if we don't have the outdoor breeding places, there are indoor breeding places.
Right. Doctor, now let's talk about the stages of dengue. Let's start with the first stage, the symptoms you see in the first stage, second, and the final stages. Let's have a simple breakdown, doctor.
Okay. Usually, with the common symptoms for dengue fever or the dengue hemorrhagic fever is fever, headache, body aches, vomiting, or the rashes, or the pain behind the eyes. It may vary from patient to patient, but initial stage, those symptoms are common. Even with patient with influenza infection, they can get these symptoms. Even patient with leptospirosis, in Sinhala we say Miuna, so they can get these symptoms at the initial stage. So it's very difficult to differentiate at the initial stage. That's why we advise the general public to seek the medical advice after about 48 hours of fever. So that's the best way of diagnosing the disease. Like it may be another disease, maybe dengue. So people should go to consult a doctor, or go to a nearest hospital and diagnose the disease.
Then how is this transmitted, doctor? Now there is a lot of questions and theories that go about this. When a dengue mosquito comes and bites an individual, there are different theories that and speculations that go saying for you to get dengue, the mosquito has to bite someone else with the dengue fever and then bite you. That's how you get it.
Yeah.
I'm sure there is more behind this. If you could address this to us today.
Yeah, as I explained before, the dengue virus is transmitted to us by a Aedes mosquito. So first, Aedes mosquito should get the virus. When they bite an infected person, like a patient with dengue fever, they get the virus to their body. But let's say now that Aedes mosquito bite me and then bite you, I had dengue fever, but you won't get the disease. It should multiply in the mosquito body, mosquito inside the mosquito midgut, and then only that mosquito can transmit the virus to another person, another healthy person.
Then doctor, now after Sri Lanka is a very rich country with a lot of home remedies that come in. One sense that comes in is they say when you get bitten even by an ant, put some garlic and the poison will come out. People try to apply the same for a mosquito bite. Does this apply, doctor?
As we are practicing Western medicine,
there seems to be a bit of a clash there, isn't it?
We do not recommend to, we advise to do the scientifically proven ones.
Exactly.
But people may do the local remedies, but they should seek medical advice when they get fever. So that's my advice to the general public. But let's say that patient is pregnant or an elderly person or the infant, they should seek medical advice on the very first day.
Are there any particular age groups in your expertise, under your expertise, doctor, you would have come across any particular age groups that are more susceptible in contracting dengue?
Actually, any age group can be affected, but the majority are within the, like 60% of the patients are within the 20 to 49 working age group.
Yeah.
That is 20 to 64, it's roughly around 60%. But school going age children, it's roughly around 25%.
Right.
So that means that indicates that they might have got the disease from the working place or school. We can't definitely say, but because they are exposed to mosquitoes during their, because mosquitoes are very active during in the morning and the evening, like 6 to 10 a.m. and then 3 to 7 p.m., 3 p.m. to 7 p.m. So most of the children are at school at roughly around 7 o'clock.
Yeah.
So they are 20% of the patients are at school going age children. They are school going age children.
Doctor, now you
Sorry,
have
25%.
25. Doctor, you have some up-to-date statistics. We will also be showing it to our viewers, but if you could just tell us the statistics that you have, doctor, as of the 29th of May, I believe.
Yeah, as of 29th midnight, the total number of dengue cases reported were 24,748. That is high number of patients. We got high number of patients in January with the north-east monsoonal rain. But this time also we might get high number of cases, so we have to be very careful. April we had low number of cases, that is 2,234. But this month we, as of yesterday, we have 2,475 cases. So high number of patients were reported from the Western Province, Ratnapura, Kandy, Kegol, and Galle.
So those are some of the statistics from the National Dengue Control Unit. Doctor, coming into my next question, the diagnosis of dengue fever, the dengue virus that we call it, the antigen versus the antibody test. Personally, there's a bit of a contrast there, doctor. You know, a lot of people have a question. The antibodies test is done, I believe, 3 days after the fever is persistent in an individual. But then again, we have a question that comes in: if a patient has dengue, that spot is quite vulnerable because over a matter of hours, the platelet counts can drop. So many things can happen in 3 days' time. So why not? Why can? Do you advise people to do the antigen test at start, doctor?
Yes, people can do the antigen test because it's available in private hospitals. So even, I mean, mainly in the private hospitals. But if you admitted to a government hospital, of course, they can do the antigen test if it's available. But it should be done in first. It's better to do it in first 48 hours because sensitivity is very high. Because positive, if you want to get the positive result, the sensitivity is very high within that period. Usually, when you after about 6 hours of fever, we advise them to get it done. Then the sensitivity is very high. But we recommend to do that within the first 3 days of fever. Then we can detect the dengue virus.
Yeah.
So it's no harm. The patient, I mean, if they think that they have dengue fever, they can do that. And also they should do the full blood count, the complete blood count.
Doctor, so just to clear things out, you all recommend, doctors recommend that if you have fever, within the first few hours or first 6 to 10 hours, get an antigen test done instead of waiting for 3 days to do the antibody test. All right. Moving on to my next question, doctor. You mentioned the completion of a full blood count report. Once a patient does this full blood count report, what does a doctor look at in this report? What do you all look for?
Actually, there are several parameters. Usually, a treating clinician, they look at the white blood cell count and the differential count. That is, there are different types of white blood cells, and the platelet count. That is very common. Even general public, they know about the platelet count, and the hematocrit. We measure the hematocrit. It's I can't explain it, but it's a red blood cell column we measure. So it's very important if the patient has the dengue hemorrhagic fever. We measure the hematocrit we monitor very frequently the hematocrit. So usually the dengue patients they have low white blood cell count and the low platelet count at the beginning, and then gradually it will decrease, and then with the recovery it will go up, both the white blood cell count and the platelet count.
So when the platelet count is quite low, doctor, are there any foods or food types that you all recommend to have, and food types that you all do not recommend to have?
If we suspect dengue fever, we ask patients not to eat like red color food like beetroot, and also brown color things like the coffee. So because the dengue patients, they might bleed internally, they might bleed. So with vomiting, it's very difficult to differentiate whether it's due to the bleeding or due to the food.
Doctor, coming back to my question about the report, I think this is very important to all our viewers watching us today. We get a report, and I think it's very human. Before we even go to the doctor, we are trying to know what is in my report.
Yes.
Even personally, sometimes I have done it, I have some symptom and I Google saying, I have this symptom, what do I have? And Google sometimes is sometimes not the most accurate platform to receive medical answers. I think this is quite crucial, doctor, because these reports have to be read by a doctor. And patients sometimes go to the extent of typing this decimal rate, is going to that level to search for their disease or what exactly they have. I know you all don't recommend it, but I think it would be better coming from you.
Actually, I personally, being a doctor, I recommend all the general public, they should go to a doctor, because they are there to help you all. So they can read the test report, and they can listen to your symptoms, and they can examine your body, and based on those results and the investigation results, they come to conclusion that whether you have dengue fever or whether you have influenza, whether you have leptospirosis or any other disease. So don't wait at home. Please go to the qualified medical doctor or to the hospital.
That is very important, and I'm glad we got that covered, doctor. Now, mild versus severe dengue cases. Not all patients have to be admitted to the hospital as well, like we were having a little chat off air. Again, the patient has to come to the doctor to know whether it is severe or not. But let's say, doctor, a patient is already at home and they show signs of hemorrhage at home. What are the symptoms we see, doctor, if a patient has internal bleeding at home?
Not only the internal bleeding, I would say, there may be internal leaking.
Right.
Yes, so fluid leaking. So the symptoms, the warning symptoms are the severe tummy ache, and then confusion and restlessness, severe headache, or gum bleeding or the nose bleeding. Those are severe symptoms. So we do not recommend to wait till that. We recommend the general public to seek the medical advice as early as possible.
Then
And also,
yeah.
I forgot to
Yes.
mention the urine output will be reduced during the severe phase.
Right. So at that time, do you all recommend? Because I don't think you all recommend either, because there is a leakage.
Yeah.
So you all don't recommend an insane amount of water intake as well.
Yeah, some mild patients, like some dengue fever patients, we manage at home. We give home-based care, but people should adhere to all the advices given by the treating physician. So if they get warning signs, definitely they should go to a nearest hospital. And as you said, if the people are experiencing the severe symptoms, definitely they can go to the nearest hospital or the doctor, and I think they should admit it to hospital.
Definitely. Then doctor, when a patient is affected with dengue, it impacts several organs. What are some of these complications that we see when someone has dengue?
Basically, patient with dengue hemorrhagic fever patients, they get complications. But even the dengue fever patients, they can get complications, but mainly the dengue hemorrhagic fever or the leaking patients can get complications. If they come to hospital, delayed, they can get complications. But if they come to the hospital early, before the shock period, then the clinicians can very well manage that the shock stage, and that patient will be fine. But otherwise, if they come late, they can get complication. All the organs can be affected and even end up in death.
Welcome back to the show this evening, and we are in conversation with Dr. Anoja on the importance of tackling the surge of dengue here in Sri Lanka. Doctor, we were talking about mild and severe cases of dengue, hemorrhage. I'm coming into a bit of a sensitive aspect here, the death rate. Sometimes it is inevitable for some patients, and it is quite unfortunate. If I was to word it, doctor, does a patient face death ultimately because of the dengue fever or because of the impact of dengue fever on the organs that it has, the complications?
First, I will explain you how the notification comes,
Yes,
death
definitely.
notification. Because once the death occurred in a hospital, if they suspect that it is due to dengue, they inform us, they notify us to the National Dengue Control Unit, and then they conduct institutional review, whether what may be the causes, whether it's directly due to dengue or due to any other cause. So once that is final, sometimes they go for for the postmortems. So they get the postmortem reports and all those things. Once they finalize whether it's due to dengue or not, they will inform us after the review. Then if it's due to dengue, we will conduct another review by a panel of experts. Then they will go through all the bedhead tickets and see whether any delays. There may be several delays. Delay may be due by the patient side, and if there is any delay in the hospital, likewise we analyze all these data. So according to the analysis that was done in 2022, we noted that there are deaths due to the delay by the patient side and also due to the bleeding. So
doctor,
there are several other causes, but those are the common
So
causes.
that is how the National Dengue Control Unit sort of gets the information
Yes.
and breaks it down whether is it due to dengue or not. Doctor, in your area of under your purview, do you really think dengue, the cause for the death of someone in dengue, as I just want to ask, do you think it's mostly because of the impact on the organs that it has, the complications that come along with it? Let's say like the extreme leakage of fluid like hemorrhage.
Yeah, it's mainly due to the shock. That is due to
Shock.
the
What does that
shock.
mean, doctor?
Shock means during dengue hemorrhagic fever state,
Yeah.
the fluid leaks out from the vessels to the other tissues. So the fluid amount in the vessels will be less. That causes the shock, because
Right.
the blood carries oxygen to all the tissues. So that may cause a shock, because there should be a set volume of fluid inside the vessels, and also there may be bleeding inside the body because of this disease. There are several complications, but fluid leakage is the main problem, and also in addition to that they might get the bleeding.
Right.
So both causes shock.
Doctor, we are going into treatment now for dengue. There is no special cure, or there is no set tablet or injection for dengue, but you all treat. How do you all treat a patient that comes in with
Actually,
dengue
as you very
symptoms?
correctly said, there's no definitive treatment for dengue. Dengue, it's a symptomatic treatment. We treat for the symptoms. Like if we detect leaking, so the treating clinicians, they give the adequate amount of fluid to replace that volume, and also they measure the urine output, the volume of urine passed, and they balance that amount, and also they measure the other parameters like blood pressure, pulse and pulse volume, all those clinical parameters. While all doing these things, they can give adequate amount of fluids and recover the patient.
For urine, for the passing of urine to be monitored,
Yeah.
it means that the patient has to be vigilant of the fluid intake, because it is connected to the fluid leakage.
Yeah, because they are in the hospital. Definitely, these patients are in the hospital. So they are. I mean, they are maybe bystander or the health staff. They can they can measure the amount of fluid that they have given to the patient, and also they advise them to measure the urine volume that they have passed.
Is there any particular reason, doctor, for the monitoring of the passing of urine in patients?
Because during shock stage, they might the urine output may be reduced. So we have to monitor that aspect as well. So we have to be very vigilant when the urine output is very low.
That means even the water and fluid intake is also monitored.
Yes.
At the same time.
Yes,
Which
both
is
are
why
monitored.
doctors advise patients to come in, because sometimes, doctor, for the influenza, they tell drink water.
Yes.
To flush out the
Yes.
whatever is inside, but in dengue it's the opposite. You shouldn't be drinking too much either.
Yeah, as advised by the clinician
And the physician.
Yeah.
So this is why doctors advise viewers to come in
Yes.
and to not sort of medicate yourself at home. Going into home remedies, doctor, another special aspect that we see in many Sri Lankans. I also, as I mentioned, doctor, even I've got dengue twice. So, and a lot of people at that time said, take tender pepper leaves, red lady, and different home remedies. Do you all advise these, doctor?
Usually we do not recommend the home remedies, because people say that after taking this the papua leaf juice, the platelet count will go up.
Yes.
But we don't want to raise the platelet count, because we monitor platelet count. If it's naturally going up, we know that patient is in recovery phase. So we should not give those type of
just to sort of increase the platelet
falsely increase the platelet count. There are so many other parameters to measure.
So that is important, doctor, because a lot of people get carried away with the internet home remedies.
Yeah.
Try this juice, try that juice, but it goes beyond that. Going into aftercare, doctor. Now, once a patient has come out of hospital and they're in their recovery stage, do you all advise patients to get back to their daily activities as usual, or do you all recommend about a 1 to 2 month or 3 month rest period at home?
It depends, because some people, some patients, even the dengue hemorrhagic fever patients, they might, if they come to the hospital early, the shock stage is well managed and they can go home very well. But some people they may be in shock stage when they are admitted to hospital, and they may be stayed in hospital for longer period, and they may be weak. It may vary from patient to patient. So the treating physicians will advise how long they should take a rest, they should take leave from the work, and what they should do, and what they should, they can eat normal balanced diet after that, of course. But resting varies.
Doctor, but of course, if a patient has been in the ICU for a considerable amount of time, of course, you shouldn't be outdoors and exerting yourself physically and also mentally.
No.
I think you would strongly advise a patient to remain at home.
Yes. Actually, even during some people even do having fever. Like some children, they do exercises, sports, and all those. So we do not recommend to do any exercise or any exhaustive activities during, especially during when they are having fever.
Yeah.
So even after settling the fever, after discharging from the hospital, even after any disease, we should take a rest.
Definitely.
Our body is a bit weak, so that the resting period may vary from patient to patient.
And another aspect that we see, doctor, and especially parents, when especially their child or teen receives or sort of contracts fever, they observe the child for about 2 days, and once the fever goes down, they're famous. Everyone is famous for taking 2 Panadols and getting away with a temperature. But once the fever goes down, sometimes the parent is unaware that the child has dengue. They think, okay, the fever is no more there, let the child get back to school. I think that is also a bit of a mistake that parents make.
Very good question, because patient with dengue hemorrhagic fever, they get this shock period when the fever settles, but the patient is ill. Even though the fever is settled, patient feels very unwell. So at that time they get the shock, start the shock period. So the parents should be very careful, when they can give paracetamol every 6 hours to bring down the fever, but they should not give any other painkillers. Those are very dangerous, painkillers or the steroids.
Then after I'm talking in relation to children, doctor, not toddlers, but children who go to school. Once a child has got dengue and the child is at home recovering, another myth that we encounter is children are, yes, of course their immune system is it's a little stronger than an adult, but maybe we shouldn't put over pressure and over stress them out in terms of getting back to their normal activities, because sometimes the child also might be taking some time to adjust their bodies to back to their normal life again. So how would you advise parents to look after their children after they have got dengue?
Yes, as I explained before, that is valid for even children, because the disease level may be different from one child to another. So the treating clinician, he or she knows very well about the child. So he can advise, if let's say that child had the dengue hemorrhagic fever and that child was in the ICU, so that child may need to take a longer rest.
Period of time to
Yeah.
rest.
So it varies, but as you very correctly said, of course they should take a rest for a certain period, even after the disease recovers.
Doctor, can dengue recur?
Yeah, because there are 4 serotypes. As I explained before, there are 4 virus types. Once you get one virus type, you get the immunity for that virus, that particular virus type, for lifelong immunity.
So if I get dengue type 1,
Yeah.
I won't get it again?
Yes.
Lifelong?
Lifelong immunity. That's what evidence says. So, but you get a cross immunity for another other 3 serotypes for another 6 months to 1 year period. You won't get any dengue.
The other 3 types?
Other 3 types. But after that, you can get the other dengue from other 3 types.
So the same theory applies to all 4 types, doctor. If I get dengue type 2 also,
Yes.
same thing. I won't
Yes.
get it again for another lifelong.
But you can get the other 3 serotypes, like type 1, type 3 and type 4.
Doctor, what happens if a patient gets all 4 types? Is it critical?
No, if patient is fine, it's all right.
Right.
I mean, as of today, what the literature says is, theoretically we can get dengue for 4 serotypes. But some people won't get all 4 serotypes.
4.
Yeah,
Right.
some might get type 1 for 1 serotype, some might get for the 2 serotypes, like that. So
Is there a variation in the different types, doctor, or is it the same symptoms
not
that we see?
because for some serotypes, like some type 3, it says the liver enzymes may rise, but not up to the level that it may cause like mortality. But liver enzymes might go up compared to the other serotypes. But some serotypes like type 2 can cause major epidemics. Like in 2017, we had a huge epidemic and we got more than 180,000 cases in ward patients. And at that time, the serotype was type 2. So even the literature, the evidence says that it might cause epidemics.
So doctor, according to the type of dengue fever you get, does the treatment vary or is it the same treatment
No.
for all 4 types?
Same treatment for all 4 types.
All right.
But the organs, let's say that the different organs are damaged, not the damage, but the impacted. So then it will be managed separately. I mean,
Right. So each type of dengue impacts, the impact is different, I would say. Different
no,
impact.
all 4 serotypes can impact any organ.
Right. Okay.
So those, but all patients, that one patient may be going to shock stage, but others may not go into shock stage due to the same serotype. So it varies.
It varies.
It's very complicated.
Very complicated. Welcome back, and we are on the final lap for the show. Doctor, before my final set of questions is on the prevention of dengue, which is also pivotal in our discussion today, I just want to squeeze in one question. Treating dengue fever for the pediatric patients, that is babies. As doctors, is that a challenge for you all? Do you think the baby is also in a vulnerable spot?
Yeah, the infants are, that is less than 1 year infants are, it's a bit challenging, but
yes.
I think they are well managed at the pediatric wards.
Yeah.
So it's not challenging, I would say, because parents, they would they will bring their children as soon as possible.
Yeah, for
not
the
like adults,
thing, yes.
slightest things. So I think very few deaths reported from among very young children.
As you said, doctor, if something happens to a child, soon as a fever starts showing, a parent will rush their child to the hospital.
Yes.
If the same theory is applied with the adults, I think
Yes.
we would make your lives also much easier for the doctors.
Yeah.
So doctor, going into prevention, as I mentioned, also quite pivotal in our discussion today. Many people, professionals, experts, activists, doctors say clean your environment.
Yes.
Is this the only solution that we have?
No, that is the main strategy, I would say. There are so many strategies. That is the main strategy. That means we should remove the mosquito breeding places. If we don't remove the places, there will be a high density of mosquitoes, Aedes mosquitoes. So that is main strategy. And also some breeding places we can't remove. So there should be another solution. So let's say the water storage tank.
Yes.
So if the lid is not there, we can ask the people to cover it with a mesh or the lid. Or else, so because in some areas in our country they have they don't have regular water supply, so they need to store water, but we can't ask them to throw.
Definitely.
So we have to give a solution. So we can ask them to cover with a mesh or a lid. And also sometimes there are abandoned wells, shallow wells. So if it's a breeding, if let's say during our entomological survey we found that there's Aedes mosquitoes in that, so we can apply any larvicide that's to kill the larvae, or else that could be chemical or the biological. Like
Right.
chemical, there are chemical insecticides, so we can apply that, or else we can put guppy fish. And also if we put guppy fish, we need to monitor whether the fish survival is there, and because it's if we let's say there are larvae in the well or the shallow well or the water storage tank, those are very productive breeding place. Like compared to yogurt cup,
Yeah.
there may be few larvae in that, but in hundred odd larvae in those water storage tanks. So we have to take control actions then and there. And also during an like impending outbreak or during an outbreak, of course we need to do fogging. It has an effect. Fogging, space spraying. People are very familiar with space spraying, like fogging. They ask for fogging, but if they don't remove the breeding place, just only do the fogging, that is not good. Because we have to remove the source. We have to do fogging during an impending outbreak and during an outbreak, because we assume in that particular period the mosquitoes around that area is infected with virus. So we want to knock down those mosquitoes. That's why we do fogging during an outbreak or the impending outbreak. Let's say one case came from this particular area, another case is appearing in that particular within the 200-meter radius area within 2 weeks. That means that is clustering around that particular area. So for that area, then we need to fog. And also we can apply mosquito repellents to prevent mosquito bites, and also we can wear long sleeve clothings. Those are the simple
some of
things,
the strategies that
yes,
we can follow.
Yeah.
Doctor, now advice that you would give for people living in dengue endemic areas, especially flats and clustered areas, how would you advise them? I'm sure it's the same strategies that we could follow, but I think we see a bit of the surge is quite high in these areas as well.
Yeah, the transmission is very high in population, highly populated areas. So they should regularly in the sense at least every week they should clean their environment. They should keep their environment free of mosquito breeding places. But let's say if they get fever, they should, as I mentioned before, they should seek medical advice before they go into complications. And also, I mean, it should be, a routine thing. They should clean their own environment. They should segregate their garbage and they should clean their environment. That is their responsibility.
I mean, there's a limit that
we can educate them, we can communicate the risk, but they should, work collectively and remove the breeding places.
Doctor, now hospitals in Sri Lanka, island-wide district, in the districts, 25 districts or provinces, are the hospitals in these areas in Sri Lanka, are we capable of handling this surge? Because we see many reports also coming in that there is a shortage of doctors and people are sort of pinpointing fingers right now to the medical sector as well. Are we capable of handling a high surge of dengue patients in Sri Lanka?
Yes. At the moment, yes, I agree that we can manage, because you can see that our case fatality rate is very low. That is 0.07 last year. That is number of patients, number of deaths due to dengue divided by number of dengue patients into 100. It's 0.07. That is very low because of the capacity and because of the training of medical doctors and the nursing officers. They look after the patients very well. But it's the responsibility of general public to maintain their premises and bring down the caseload. As you very correctly said, if the caseload will go up beyond the capacity of the hospitals, the deaths will rise. That we should keep that in mind.
So this is where a collective effort comes into play.
Yes.
We can't completely burden the medical sector if we are negligent on our end. So the general public also has to step in and take our responsibilities also quite seriously. Doctor, now
can I interrupt you?
Yes, definitely.
Because we do have a presidential task force level structure to manage dengue, because this dengue hospital level, of course, medical people can manage.
Yeah.
But with regard to the prevention, we need the help of other sectors. Let's say the about 30 to 40% of the breeding places are discarded items. So this garbage has to be collected by the local government, local authority. They have a big responsibility. So we need intersectoral collaboration, and also Triforces and the police department, they help us in several ways, because we do conduct special mosquito control campaigns. So they give us a very good support to visit house to house and see the breeding places and educate the general public. Currently we are conducting special mosquito control week extending from 26th May to 1st of June. So I think we need to work together to bring down the caseload of dengue.
So it also comes down to a breakdown of power as well.
Yes.
General public, ministries have to step in, Triforces and other sectors as well. Doctor, as you mentioned, it is National Dengue Control Week. Throughout this past week, what has the National Dengue Control Unit, what have you all been doing?
During this special mosquito control, because we have identified the high-risk districts. Within that high-risk districts, we have identified 71 medical officer of health areas. So we conduct the special mosquito control campaign in 41 MOH areas from 27th to 29th, that is yesterday. From 30th to 1st of June, we are conducting the program in another 30 MOH areas.
When you say programs, Doctor, what sort of programs?
Because we provide funds to conduct these programs, and they do house to house inspection program. One MOH area, they get 10 teams, so roughly they inspect 40 to 50 houses. It depends on the area. So based on those results, we take actions. if we, let's say, if there are more potential breeding places or the positive breeding places, because every day we do conduct debriefing sessions at 4:30. So we discuss with the district people, they present all the data, and we identify what are the gaps, what we should do, what are the next steps to bring down the disease.
Doctor, just one small question that I would like to ask you. When these MOH officers go from house to house, do they go with some sort of identity or credibility badge? I'm asking this due to a reason, because we see these days there are a lot of robberies, people going under disguise saying I'm from this ministry, that ministry, or this officer. How do we know if they're really from the MOH?
Usually, I said there are 10 teams. There should be one health personnel for each team.
Okay.
And also police person should be there.
Right.
So, and the Army, Navy and Air Force.
So during these house visits, someone from the Tri-Forces is also present?
Or the police, and the one health person is there. And also if there are volunteers, they also can join. So it's better if the village people are also joining, because they have to maintain their own environment free of mosquito breeding places.
Definitely, because some people take advantage of these campaigns that the ministry does for their own advantage. So it's important that we break that myth. Doctor, time is ticking. And what is your take-home message to everyone watching us today?
I humbly request from the general public, please keep your own premises, I mean inside the premise and the outside the premise, and also your working place. And from the children, their schools, please keep your, let's think that all these are your own premises, and keep these premises free of mosquito breeding places. And when you get fever, please consult a doctor or go to the nearest hospital and get the treatment.
All right, Doctor, thank you for joining us today. It was a very informative discussion, even for me. I learned so much. Thank you for taking the time to join us today.
Thank you for inviting us.
So we were in conversation with Dr. Anoja Dheerasinghe, consultant community physician from the National Dengue Control Unit from the Ministry of Health. So until we meet again on yet another edition of The Spotlight, stay safe and have a pleasant night.